Kinds of multimodal remedy. There are exceptional varieties of multimodal therapy combinations, verified to most successfully treat sorts of mesothelioma. Many multimodal treatment plans, started as unconventional approaches, however are now being recognized for their innovativeness in targeting and treating mesothelioma. SMART. SMART is the technique of the use of multimodal remedies to influence the life expectancy of mesothelioma sufferers, but using a way that switches around the order of treatments to enhance effects. SMART is a two-step technique that includes intensity modulated radiation remedy, IMRT. Patients are given a high dose of IMRT, which administers simultaneous tiers of radiation through the vicinity. Radiation degrees are higher than regular treatments, and are made feasible simplest due to the fact the irradiated lung is eliminated shortly after the remedy, EPP. Extrapleural Pneumonectomy, EPP. Approximately 6 days after an affected person is given IMRT, the affected lung and surrounding tissue are removed. Further studies are being conducted to attempt to store the lung for patients in the future, a tumor, at the same time as the alternative mesothelioma cells are killed, at some stage in the chest hollow space. Being capable of providing higher doses of radiation than casting off the lung has extended outcomes, due to the fact the chances of the radiation, or cancerous cells transferring through the body are deliberately restricted. Every other factor is that giving radiation earlier than a surgical operation is less difficult for sufferers to get over than giving radiation before a surgical procedure. Intraoperative chemotherapy and radiation. Delivering irradiation. Intraoperative radiation, or chemotherapy. Intraoperative chemotherapy capsules in the course of surgical treatment is frequently used to improve management of the area of the tumor at some point of operations. Frequently, this dose of radiation or chemotherapy is restricted through the presence of wholesome tissue in an identical place. Multimodal therapy survival rates. Survival fees are used as an approximation of lifestyle's expectancy for patients with a similar analysis survive. That information range is based totally on a selection of factors that include age, gender, stage of the most cancers, cell type and histology, treatment alternatives. Survival costs for plenty of sufferers can differ from the initial analysis due to numerous elements or misinterpretations. Now and again they range irrespective of remedy or because of the approach of remedy. As people are unique, survival costs also can be unique and have to handiest be used as a guideline. Talk to your doctor approximately survival rate information and issues you could have, as those vary because of the elements indexed above and any potential breakthroughs in cutting-edge research. Multimodal remedies with new remedies. Medical trials are a huge source of development for brand spanking new remedies and procedures for sufferers that do not have the choice of traditional treatment plans or remedies. If the cancer is just too superior, a clinical trial and a mixture of different remedies may be the best hazard to increase existence expectancy or enhance fin of life. Speak in your medical doctor's approximately modern-day clinical trials or multimodal treatment plans in combination with new treatments available in clinical trials to examine if this feature is the quality method for you. For greater data on running with a mesothelioma specialist close to you, contact our affected person advocates these days.